So in today's lectures we are going to talk about anatomical terminologies. So the first terminology is anatomical positions. So anatomical position, it is a reference point on which all the anatomical terms are described. So this is the anatomical position. So what are its features? So the person should be standing upright. So as you can see, the person is standing upright and head and eyes directed straight ahead. So as you can see, patient is saying directly straight, so and head is straight ahead and upper limbs are at the sides. So you can see these are its upper limbs which are at the sides and upper limbs slightly away from the trunk. So this is the trunk and it is slightly away from the trunk. Upper limbs are slightly away from the trunk and palms facing forward. So these are its palm and you can see they are facing forward. Thumbs pointing away from the body. As you can see, these are thumbs and it is away from the body. Lower limbs are parallel. So as you can see, these are the lower limbs and they are parallel to each other. And feet flat on the ground and facing forward. So feet are flat to the ground and they are facing forward. So now let's talk about other position other than the anatomical position. So there are four positions. So second one is supine position and opposite to that is prone position. So in supine position, a person is lying on his or her back. So you have to just remember this. Patient is lying on his or her back. As you can see, the patient is lying in the spine position on his back. And opposite to that prone position, the person lying on his or her face and chest. So it is patient is lying upside down. So this is the prone position and this is the spine position. And the last position is lithotomy position. So as you can see in this, the person lying on her back with legs up. So as you can see, legs are up and feet are supported by the straps. So as you can see, these are the strap and it is supporting the feet. So it is mostly used in the when mother is trying to deliver the baby. So now let's talk about another very important topic, which is anatomical planes. So what are anatomical planes? So these are imaginary lines which are drawn through the body. So these are the imaginary lines which are drawn through the body and they are of three types: sagittal plane, coronal plane and transverse plane. So sagittal and coronal are both the vertical planes as they are in the vertical direction. So this is the sagittal plane and this is the coronal plane, and one horizontal plane which is also called as a transverse plane. So this is the transverse plane. So we will discuss one by one in detail. So now let's talk about our first plane, which is sagittal plane. So in this plane, a vertical line is dividing the body into right and left section. So and it is of two types: mid-sagittal plane and parasagittal plane. So it is a specific sagittal plane which passes through the midline of the body. So this is the midline of the body. So when it is passes through the midline, then it is called mid-sagittal plane, and when it is off center from the midline, then it is called parasagittal plane. And one thing to remember, we can easily remember the sagittal plane as it is as for side view. So this means when we see from the side, then we get the sagittal view. So for example, when we cut the patient from here, then this is the side view of the brain. So this is the sagittal section of the brain. And also one most important thing is that a suture is named after this sagittal plane, that is sagittal suture. As you can see, it is passing through the midline. So this is called sagittal. Now let's talk about the last two sutures, which is coronal, or it is also called as frontal plane. or transverse plane or axial or horizontal plane. So coronal, it is a vertical line. So this is a vertical line which divides the our patient into front and back region. So it divides the body into front and back region, which is also known as anterior and posterior, anterior and posterior. And the simple thing to remember it is frontal view is equal to front view. So when we are seeing from the front, then it is coronal plane, and a suture is named after it, that is coronal suture. As you can see in this diagram, this is the coronal suture. Now let's talk about the third plane, which is transverse plane or horizontal plane. So it is a horizontal line which cuts the body into superior and inferior part, or top or bottom part. So and the simple thing to remember is from T we call it top view. So now let's talk about our next topic is, which is anatomical terms. So there are total 10 terms, so we are going to discuss one by one. So the first one is ventral, or another name is anterior, and opposite to that is dorsal or posterior. So ventral is front of the trunk. So as you can see in this diagram, so this is our trunk and this is the ventral surface and this is the dorsal surface or posterior surface or anterior surface. So front of the trunk is called ventral and back of the trunk is called posterior or dorsal. So now let's talk about third and fourth anatomical terms, which is medial and lateral. So when we take an imaginary line which passes through the center of the body, then it is called medial line, and when we go toward the medial line, then it is called medial plane, and when we go away from the medial line, then it is called lateral. So when the plane close to the medial line, it is called medial, and which is lateral or away from the medial line, this is called lateral surface. Then fifth is superior, and another name is proximal or cranial. So superior or inferior, when it is close to the head, so it is when closer to the head, then it is called superior, and when it is away from the head, then it is called inferior or lower part. Then upper is equal to superior, proximal or cranial, superior, inferior. When it is lower, then inferior, proximal, and opposite to this is distal, cranial to caudal. So cranial is, it is the another name for our brain. So here is our brain, so it is called cranial cavity. And then the caudal, it is a primitive name which is used for the tail. And now let's talk about the last four terms. So the seventh one is ipsilateral, which means on the same side of the body, and contralateral, on the opposite side of the body. So let's see in this diagram. So let's take this arm, so it is on the same side, then it is called ipsilateral. And then we take this arm and compare it with, so this is the median line and this is on the one side, but this is on the opposite side leg, so we call it contralateral. So it is on the opposite side and this is on the same side. And the ninth and 10th, which is superficial and deep. So let's understand with this example. So our uppermost layer is skin, and below it present are the superficial veins, and under it there are deep arteries. So superficial is used for the term which is close to the skin or toward the body surface. So as you can see, superficial, so these are used for superficial veins. So as superficial is above the deep, and deep is away from the skin or away from the body surface. So this is away from the skin, so this is called deep